The following presentation will focus on de-escalation of combative or aggressive patients. By the end of this presentation, staff will be able to recognize the potential for violence or threatening behavior, apply key skills and strategies to effectively manage disruptive and aggressive behavior. Lastly, utilize effective communication techniques when caring for disruptive or aggressive patients. The rate of violent events is 3 times greater for healthcare workers than for all other occupations. 80% of these injuries occur from the patient. From 2011 to 2018, violent incidents rose from 6.4 to 10.4 for every 10,000 full-time employees. Since the onset of the pandemic, violence against hospital employees has increased further. The the Joint Commission affirms that proper verbal de-escalation tactics have positive effects in preventing violent behavior and also avoiding the use of restraints. The most effective de-escalators have been found to have the following skills: honesty, confidence, non-judgmental attitude, a permissive, non-authoritarian manner or tone, and the ability to empathize with patients. These skills are essential to a situation that has not yet become physically violent. There's a spectrum of aggressive behavior, from less severe, such as restlessness and irritability, to more severe, such as combative and violent behavior. The goal of de escalation is early recognition to decrease agitation and reduce the potential for associated violence. It is best practice to diffuse the situation early before it escalates to a more aggressive behavior, as it becomes increasingly more difficult for clinical staff to de escalate and take control of the situation. A clinical situation where the escalating person has dementia or delirium requires an even more specialized set of skills. For this patient population, it is best to give space. It is possible that their resistance may be attributed by their perception of personal space being invaded. Do not argue. Arguing with this type of patient population almost never works. Make sure you give them plenty of time. If you're helping a patient complete a task and they become angry, try backing off for a few minutes. Use distraction. Offer either a snack, music, or an activity. For example, having someone fold some towels to help you. Lastly, it's important to offer options or choices. It is possible that the patient's perception of loss of control is aiding in their frustration. By providing choices or options, it gives the patient a sense of autonomy. These are the most common de-escalation steps to help you safe and diffuse an escalating situation. First thing is to call for help. Never attempt to de-escalate a potentially violent situation without first making sure your colleagues are aware of what's going on. De-escalate yourself. The outcome of this situation will have a great deal to do with your own emotional status. You must be able to recognize when you are being emotionally triggered. It is very common to become emotionally triggered. Thus, you may recognize you are becoming more argumentative, defensive, or aggressive in your tone. It's best that you not react to the situation, but rather respond with a very particular set of skills and strategies to help support and recover the person from their heightened, agitated state. Focus on your environment, also known as situational awareness. Immediately assess for any potential issues or threats in your physical environment. These may include things such as other people, colleagues, family members, physical objects, which can potentially become weapons. Know your physical space and surrounding, the layout of your environment, and always have a clear exit plan. Keep or express your body relaxed. Remember to stay at eye level with the patient. And lastly, body skills. The rule of thumb is to stay at least 2 arm lengths distance away. Never attempt to single-handedly block or restrain the person. Stand at a slight angle, which appears less confrontational. Body skills is a key component because 90% of all emotional information and 50% of spoken information is communicated through your body language. So during this time, you should be doing more listening than actual talking to the patient. Some more verbal de escalation skills include being authentic, concise. Remember to keep it simple. People who are aroused and agitated may have difficulty processing verbal information. So it's key to use clear and concise language. Try to refrain from using medical jargon as it may increase confusion and agitation to your patient. As previously mentioned, be prepared to listen twice as much as you talk. Try to use a soft tone, which helps express empathy. And aggressive patients often don't understand and it can lead to aggression. Hospitals are a place where frustration can trigger someone to act out who already don't feel very well. Always remember to identify yourself and that you're here to help. Listening skills. To understand what another person is saying, you must assume that it is true and try to imagine what it could be true of. George Miller. Essentially, what this quote is saying is acknowledging that everyone has their own truth, and instead of trying to bring someone from their truth to yours, it's better to communicate. Better communication occurs when you look for a place where those truths overlay and at least touch up against each other. Even if the person is obviously to you wrong, you might imagine how this is true for them and guide the conversation to explore this. If there is no way you can find a way to agree with the person's point of view, you can acknowledge that you believe they are having this experience and you can simply agree to disagree. Documentation and debrief. Accurate documentation includes the date and time the incident occurred, the location, who was present. Don't forget to record your interventions and the patient's response. You can use direct quotes. Documentation of the names of the people you notified and their responses, such as family, the doctor, or your upper nursing management. Know any injuries that occurred as a result of the from the violence of the patient or yourself or other staff members. Don't forget to fill out a UOR. We have a policy and procedure called Managing Combative or Aggressive Patients, Nursing Practice Policy 3032 to always reference. And please don't forget to use the green blanket to aid as a visual aid or cue that the patient has combative history or current aggressive behavior. This information should be shared during handoff communication. Anytime you encounter an escalated situation with a patient, know that there should be some form of informal debrief amongst team members involved. In addition, you also have EAP, your Employee Assistance Program, offered to all employees if required. Lastly, I have two videos to demonstrate clinical scenario where verbal de-escalation is done by a medical health worker. As you watch this video, I want you to pay particular attention to how the healthcare worker introduces himself, how he positions his body in a non-threatening manner, his therapeutic listening skills. In addition, I want you to pay attention to how the healthcare worker diffuses the situation. Take note the patient's body language and mannerisms. Sometimes the patient can demonstrate early signs of restlessness or potential escalation. Main points from this video I want you to take away back to your clinical practice is empathetic listening, repeating some of the patient's words or statements that are concerning them, using statements such as, "This is a safe space. I want to help you. How can I make you feel safer or better?" Providing distance between you and the patient when you identify signs of escalation. And lastly, offering choices to the patient to help give them a sense of regaining control of their environment. This next video walks you through the 10 elements of verbal de-escalation in great detail. I encourage you all to use these verbal de-escalation techniques in your clinical practice. This concludes the end of this presentation. Key points to take away back to your clinical practice. Ensure the safety of the patient, staff, and others in the area. Help the patient manage their emotions to regain control of their behavior. Avoid the use of restraints when at all possible. And lastly, avoid coercive interventions that may escalate the situation further.